we're talking about a team, a group that are impacting society positively. Not too long ago, they came together and it started on WhatsApp. If you ask me, this one was supposed to have been a member of this team. What happened? They sacked you.
Charlie, I wasn't keeping up with the WhatsApps, man.
They sacked you, but you live on social media.
So how come? I live on Twitter, not WhatsApp.
And what's the difference?
I'm mounting a comeback. Don't worry.
You're mounting a comeback.
The president is here. The president is here, so don't worry.
It's a very good opportunity to do that.
On national television. Indeed. Franklin Soho is the president of Paddies. Frankly, you're welcome, man.
Thank you very much, Kafu.
And nice Mr. Girmay Haile is the UNAIDS country director for Ghana. You're welcome, sir.
Thank you very much.
Okay, so let's start with Franklin first.
Franklin, yes, of course. President Paddies, tell us, why are you here? What brought you to our humble abode? You know this is our palace, by the way.
Yes, it is your palace. It's a lovely palace.
Thank you.
Thank you.
It's welcoming. So thank you
Tell us
very
about
much.
Paddies and then why you're here.
Yeah. Right, so good morning to viewers, and thank you very much, GHOne, for the support so far. Paddies is basically a group of friends from diverse professional backgrounds with the belief that no matter how little you have, you can still make life better for other people. We came together 2 years ago, and we thought that we have different networks, we have different contacts, we have different professional skills and abilities. And so voluntarily, the very little we can do to educate people on health, to support people along the lines of education generally, and then health, and of course some social interventions that we believe need to be addressed in whether big or small ways. It is always necessary to offer the right support to society, to communities, to individuals where need be. And so 2 years ago we started friends on WhatsApp, chatting here and there, talking about various issues, and at a point we said, come on, looking at the kind of people we have as members of Paddies, we have the capability to transform lives. We have the capability to support socio-cultural, socio-economic development of our nation. And so we resolved to formalize Paddies. So yes, we are still on WhatsApp, but we are a registered NGO in the books of Ghana. And so far it's been exciting.
Someone is missing out. And for your information,
the level has gone up, man.
CEOEIB Network is a member of Paddies.
Indeed.
Nathan Kwabnedisi, aka Bulare, he's also a member of Paddies, right?
Yes.
But you chose HIV and AIDS, and of course Ebola. Ebola has been in the news. We thought that it had kind of, subsided. Not too long ago, we had some cases in Sierra Leone, for instance. So, why Ebola? Why HIV and AIDS? Because when we talk HIV and AIDS, for instance, we're reading of report that suggests that rate of infection is kind of slowing down.
And typically in our society, most of the time, immediately we go silent on stuff. Quietly, the harm is being caused. And steadily, you realize that reported cases probably are not out there, but for all you know, people are really dying in numbers. And there are times that people die and, for whatever reason, you don't disclose what killed them and all that. But we believe that it is still prevalent, and especially along the coastal belt and communities that have huge numbers, densely populated communities are at risk. So I think last year at a point, we had a very good partner in the massive cooperation, of course, and support that we received from Haile and his team. And so UNAIDS signed us on that. Paddies, we believe in what you are doing so far, and we think that together we can drive some activations around these two diseases. And so sustained education to ensure that we try as much as possible to evacuate these two diseases, at least in Ghana, is what we aim to do. And
right.
it's typically within communities, kind of low-key, but making sure that we are training people to understand what it is. We are training people to stay off it. We are training people to know how to manage it if the crisis comes up. And of course, people should know what the response should be, just in case you identify some symptoms.
Okay, at least currently we've been blessed as a country. We haven't recorded any case of Ebola yet. If I'm wrong, I stand to be corrected. So somebody might ask that why are we fighting something that does not exist? Let me come to you, Haile.
Well, thank you very much. Talking about Ebola, yes, it hasn't manifested itself in Ghana, luckily and thankfully. However, I think it is something that the country needs to be prepared for, an eventuality. One thing that we want to talk a lot about Ebola now is because it has no treatment and it has no cure. So therefore, at any time, it can come and then it can affect communities in large numbers.
Is it like when HIV/AIDS first came years ago, when there wasn't any treatment at that time? Is it parallel?
Well, it is an infectious disease, so it does have a similar character at some point. But then as it evolves, then it develops into an epidemic of its own specific character. In the Ebola case, it's a faster acting virus, and it kills the person within a short period of time. And it passes through from people to people, not through like that normal, we know in HIV through sexual mostly and those kinds of contacts, but this is on a everyday to day type of contact, handshaking, being close to the person and having that physical contact. So we say that this is probably a more serious killer in a short period of time for our kind of societies because our culture is very much physical. There's a lot of touching, there's a lot of sharing of food, there's a lot of variety of foods also that we eat that expose us to such infections. So we are lending that experience that we have in terms of fighting this infectious disease in HIV to that of Ebola.
I'm just wondering, for such a busy person like you, what did these people at Paddies say to get you on board? Because you are stretched. Why UNAIDS and Paddies collaboration?
That is a very good question. I'm glad you asked. If you remember a couple of years ago, we launched a very wide campaign called Protect the Goal campaign.
Yes.
And the strategy...
I took a photo with you on that, holding the football.
Yes, you were one of our supporters in that. The strategy there has been to look for people who have big numbers of followers and who are also seen and respected by their followers and fans as their role model. So if you try to get this kind of messaging through to people, one, you will get big number of people in terms of messaging, and two, you'll also get the right kind of communication taking place because people are already used to communicating or communication coming from these people, from the celebrities. So Paddies, all of a sudden, I discovered has all the celebrities and there. So we said, let's go for it. Because what we did in the Protect the Goal campaign was we said there are about 340 or so highly known celebrities, at least based to our classification, celebrities in Ghana. So we said, out of these, if we get 120 of them, and we took all the names and added all the fans and everything, then we have a chance to get to 5 to 7 million people. So we attracted those 120 and 30 celebrities, including yourself. And now we are reaching out to close to 7 million people around the country and beyond. So this is how we became friends with Paddies, because they really are the right organization for that kind of outreach.
We, as friends, share a common interest, which is being selfless. So we have monthly dues we pay, and then of course we also have voluntary contributions anytime there is need to offer some kind of support. Indeed, that is what we have done for the past 2 years. We were able to support the Peace FM Project 100 that one of our members, Kwame Sifakai, led that campaign. We supported that campaign. We also supported Ochami Kwame hepatitis B inoculation. And then, of course, we adopted a village behind Pokwasi called Koteman. The first year, we were informed that's a village that survived mainly on some little stream there. So in seasons where rainfall challenges drought and all that, then there's a problem there. And the entire village was supported by just one polytank. So
Wow.
when the polytank is off, water is out of the well or stream or whatever, then they are in crisis. So first we partnered with Poly Group. We bought one 10,000-gallon polytank, and then Poly Group also donated one. And then we went and donated it to the community. They had a small community clinic. So because we have doctors as part of Paddies, the medical team worked with other partners, and then we were able to also come up with some equipment and, of course, other medication and hospital facilities. And so later part of last year, went back to the community after they had installed all these polytanks and they were using it, and the community was really, really happy. We had a health screening within the community. We donated equipment to the community clinic, and then donated shoes, sanitizers, medication, and so many other stuff, clothes and other things to the community.
So how are you able to monitor, the level of progress or impact with all of these donations that you take to these communities?
What we do is that we have periodic unannounced visits to the community. We also have contacts of some key opinion leaders who we kind of have an initial chat with them even before we start some of these projects within the communities, and they have a clear understanding of what the expectations are and what we expect, what we aspire to achieve. So periodically we get updates from them. When there are challenges, they hint us. When things are going well, we are also happy. By mid-year, we'll be going back to Kotelman to just assess the impact of what we did the last quarter of last year, the quarter 3 into quarter 4 last year. And based on that, we'll see where they are now, we could also start looking at other communities.
Haile, let me ask you briefly, with your experience at the UN, and indeed, usually when we talk about such support for, vulnerable communities, you think that you're kind of making them more kind of reliant on you, dependent on you. Is that what you get working in the UN for the period of time that you have worked?
Well, a prolonged aid does create dependency. But sometimes also the programs that you give or provide are programs that empower the community to pick up from that point and move on and further develop on that. And those are the kind of developmental assistance that we usually talk about. In this case, for instance, I don't know about distributing clothes or whatever, whether that is a lasting support, but the fact that they have solved the water supply now really makes a lot of difference to the community. That means sustained health for the children and the family. That means more hygiene in the area. So that means, it means a lot of things. So those kinds of things are very critical in such interventions, and they tend to now push the society forward in terms of empowering them and being able to do the work. Okay.
You spoke about the power of celebrity, and we'll speak about your event pretty soon. But I just want to find out from you, Mr. President, who are the people in Paddies? Bola is there, we know.
Bola is there.
You mentioned Kwame Sefaka. Who else is on it?
Kafu used to be there.
Yes, but I'm not there now. But don't worry.
We have KOD.
Okay.
Chami Kwame used to be there too.
Okay.
So Chami Kwame probably fell when you fell. And then we have Chantel.
Okay.
Who's on Basat.
Okay.
Josie's there.
Josie's there.
Okay, TV3.
Franklin is there.
I'm not a celebrity.
Oh, you have A-listers.
Can you imagine this man presiding over all of these celebrities?
And then
you are such a big man.
FC is also there.
Okay.
Of Imani, Franklin Kujo.
Oh, Franklin is there as
Yes.
well. Okay, really.
Those who care to know, Jojanda is there too.
Oh, okay. It's big.
Kojo Ponkoma used to be there.
All right.
Okay, let's talk about those who are there and stop mentioning those who used to be
No, I mean, once a party, always a
Always a
party,
party.
because they believe in the party direction.
There's hope for me.
And the party vision. So
Is
yes,
Atwafo still there?
Atwafo also stepped aside.
But they can always come back.
But they're always parties. The truth is that anytime we meet, we talk about progress, we talk about initiatives, potential ideas, and all that. So, I mean, we still have the collaboration. We invite them for activities. If they are available, they join us and all that.
Philip
So,
Ayesu as well.
Philip is there too, yeah.
Okay, great.
Philip is
Charles,
there too.
yeah.
Yeah.
Oh, great.
And then Sammy B is there too.
Okay. It's quite
So
a heavy
I
duty.
know. Maybe I should be. I'm not a celebrity though, but maybe I would love to come.
Well, her husband is
like
there
to
representing you.
network.
Your husband is there representing you.
I would like to network.
No problem.
Excuse me?
Your husband is
Okay.
there. Listen, there's something exciting happening on Saturday with Paddies. Give us a sneak peek.
Saturday is one of the most exciting days we are hoping to experience, especially because this happens to be one of the first initiatives with the partnership we have with UNAIDS. We are hitting the streets of Jamestown, driving sustainable education around HIV/AIDS and Ebola. Now, the three major things we want them to know around HIV/AIDS is the fact that we don't want new infections as far as HIV is concerned. It is zero new infections. It is zero discrimination. And it is zero death related to AIDS. We don't want anybody to die as a result of AIDS. We don't want anybody to be discriminated against, and we don't want new infections, basically. And therefore, Ebola, we are telling them that we have our culture as a people, but because these things are likely to be hitting anybody, let's be careful. Possibly the personal contacts, avoid if possible. Keep the environment clean. You know, the coastal areas and the issues there. So the environment has to be clean. We need to consistently wash hands, sanitize our hands. Everything we are doing, we need to be conscious that these diseases are real and it could happen to anybody. You don't underestimate it, and you eventually land yourself in a mess.
Of course, especially for overly populated communities like
Absolutely.
Where you're going.
Yeah.
So that definitely is the criteria for selection.
That's the criteria for selecting Jamestown, and I believe other areas will be driving this particular project will be coastal belt and highly populated areas.
So, Doc, we're looking more at preventive measures, right?
Yes, correct. And these preventive measures are related to a lot of other activities going on at the same time also through the Ministry of Health and the AMA as well. For instance, hand washing is a major thing. We talk about hand washing when we talk about cholera. We talk about hand washing when we talk about Ebola. We talk about sanitation generally and hygiene when we talk about health overall. So this is just a building block that will contribute towards the bigger issue of well-being and health. And the best way we believe for people to be healthy is to be informed properly. And the kind of information that is consumable for them also. Because a lot of information flies out, but not all the information that comes out, even though it may be scientifically appropriate, may not be an empowering information. So we are talking about how do we empower people with